Hi, my name is Julia Rumley, and I'm a first-year pharmacy student at the University of Minnesota in Duluth. This is my digital story. As pharmacists are beginning to play a more active role within healthcare, our current system is shifting more towards patient-centered care. In this approach, the patient is able to also actively participate in their own care by using their values and needs to guide the treatment process. The patient becomes more than a list of medical conditions in the eyes of healthcare professionals and can be treated like an individual. For example, at the Moose Lake Correctional Facility, patients are able to discuss their conditions and treatment options with pharmacists one-on-one to learn how to best care for themselves. Pharmacists in this way can play a huge role in educating their patients, helping them achieve more autonomy throughout their treatment. Because their patients can come from a variety of backgrounds, pharmacists have a responsibility to learn about the perspectives of different populations, as well as the factors which impact their health. By understanding the ways that factors such as race, gender, sexuality, geographic location, and socioeconomic status influence the accessibility of healthcare, pharmacists can brainstorm ways to make their care more consistent for their patients. The first 2 weeks of our Becoming a Pharmacist course focused on the needs of rural communities, and we were able to visit several of these communities to learn more about the conditions and challenges that are prevalent in these areas. Patient care and interprofessional collaboration rely on clear communication to provide optimum care to patients. At the Sandstone Retreat, we learned the usefulness of paying close attention to verbal and nonverbal cues in completing challenging tasks. For example, the water bucket challenge required us to watch for hand signals and other body language from teammates, whereas the tennis ball game relied heavily on clearly communicated words and tone. In a healthcare setting, pharmacists must stay open to different forms of communication so that they can gauge the patient's comfort level and understanding of their treatment. Interprofessional collaboration, or the codependence of a variety of professionals on each other for the purpose of optimizing patient care, allows for professionals to focus on their specialties when treating a patient. For example, the physician is able to offer their expertise on diagnosis, and the pharmacist is able to propose the best medications for the patient. In this way, professionals can exchange valuable information with each other to improve their patient's condition. On our field trip, we were able to learn about rural healthcare alongside first-year medical students and discuss our observations with each other. By exposing ourselves to interprofessional teamwork during our educational experience, we are preparing to enter the healthcare workforce as respectful teammates and leaders. By reflecting on our experiences, we are able to interpret mistakes and successes and measure our own growth. Throughout my career in healthcare, I'm sure that I will reflect on my experiences both as a patient and as a pharmacy student, and continue to learn new things about the role I play as a pharmacist. Thank you for listening.